Electrocardiogram, ECG. An electrocardiogram, ECG or EKG, is a medical test that records the electrical activity of the heart over a period of time. It is a commonly used diagnostic tool to assess the heart's rhythm and electrical function. ECGs are valuable for detecting various heart conditions and abnormalities. Here's how an ECG works and what the different components and waves represent. Principle: the heart's electrical activity is generated by specialized cells that initiate and conduct electrical impulses, coordinating the heart's contractions. These electrical impulses create a pattern of changes in voltage across the heart, which can be detected by placing electrodes on the skin's surface. These electrodes are connected to a machine that amplifies and records the electrical signals as a graph. Components of an ECG. P waves. These are the first deflections on the ECG. They represent the depolarization, contraction, of the atria, the upper chambers of the heart, as the electrical impulse spreads through them. QRS complex. This complex consists of three main waves, Q, R, and S. It represents the depolarization of the ventricles, the lower chambers of the heart, as they contract. The QRS complex is usually the largest and most prominent part of the ECG. T wave. This wave follows the QRS complex and represents the repolarization, relaxation, of the ventricles as they prepare for the next contraction. U wave. This is a small and not always present wave following the T wave. Its significance is not fully understood, but it's thought to represent the repolarization of a certain part of the ventricles. Segments and intervals. PR interval. This interval measures the time from the beginning of the P wave to the start of the QRS complex. It represents the time it takes for the electrical impulse to travel from the atria to the ventricles. Abnormal PR intervals can indicate conduction abnormalities. Saint segment. This segment is the flat line between the end of the S wave, or R wave if there's no S wave, and the beginning of the T wave. Changes in the ST segment can indicate ischemia, lack of blood flow to the heart muscle. QT interval. This interval measures the time from the beginning of the QRS complex to the end of the T wave. It represents the time for both ventricular depolarization and repolarization. Abnormal QT intervals can indicate a risk of arrhythmias. Uses of ECG. ECGs are crucial for diagnosing various heart conditions, including arrhythmias, irregular heart rhythms, myocardial infarction, heart attack. Characteristic changes in the ST segment can indicate tissue damage. Ischemia, insufficient blood flow to the heart. Conduction abnormalities, issues with the electrical pathways. Hypertrophy, enlargement of the heart chambers. Electrolyte imbalances. Certain electrolyte levels can affect the heart's electrical activity. Interpreting an ECG requires medical training and expertise, as the patterns and changes can be complex and subtle. Always consult a healthcare professional for accurate ECG analysis and diagnosis.